What I do see on a regular basis is that more things are pushed to co-payments to consumers. So rather than Medicare premiums going up drastically, the out-of-pocket cost for a prescription drug is going up.
Medicare advice on Consuelo Mack Wealth Track.
Funding provided by ClearBridge Investments, First Eagle Investments, Royce Investment Partners, Baird, Matthews Asia, Strategas Asset Management, and Women Investing in Security and Education.
Hello and welcome to this edition of Wealth Track. I'm Consuelo Mack. Our focus today is getting the most from Medicare and avoiding costly mistakes in the process. 10,000 Americans a day are turning 65, which qualifies them for Medicare. Nearly 66 million Americans are already enrolled in the program, and their numbers are expected to grow to 80 million by 2030. That is the reality of the nation's health program for seniors and for under 65s with long-term disabilities. But there is another reality we are focusing on today. According to this week's guest, nearly 95% of Medicare beneficiaries are paying too much for their Medicare coverage, and with her help, we want to make sure that we don't. She is Medicare expert Katie Batava, founder and president of GoodCare.com, a healthcare consulting firm for individuals, small businesses, and financial planners. She is a registered nurse with a PhD in health economics and nursing. And she is the author of an Amazon bestseller, Making the Most of Medicare, a guide for baby boomers, now in its 9th edition. The last time we talked to Batava was in a podcast during COVID, when we discussed how Medicare was expanding its coverage in new areas, such as telemedicine and some online services. I asked her what changes are now permanent and if any have gone away.
During the public health emergency, which came on because of COVID, there were many laws that were changed temporarily, and they did affect health insurance and in particular Medicare. Two of the biggest changes were that telehealth was broadened dramatically and allowed people to get telehealth services, whether it's mental health or seeing your primary care doctor or many other services. Now the telehealth service is still available under Medicare, but it is much more limited. One of the biggest limitations is that you have to have your care provider, your nurse practitioner or doctor in state where you live, and you have to be in state. During the public health emergency, people could work across state lines, which actually makes sense in anything that's internet-based. And that has reverted because states license everybody. And so how that will change down the road, I don't know, but the telehealth is more limited than it was. Another thing was that people could get large numbers of COVID tests for free for themselves under Medicare. That's no longer available. Insurance under 65 may still be providing it. So if people need tests, they will have to pay for them themselves, or if they go to a doctor's office, it might be rolled into there, but those home tests are no longer covered because the public health emergency has expired.
Looking over the 9th edition of Making the Most of Medicare, which is your wonderful Medicare guide, I was just struck again by how confusing and complex Medicare is. So I just thought, for the benefit of myself, but also our viewers, I wanted to kind of do a Medicare 101 with you and take us through the different parts of Medicare, and then you can explain to us how to avoid making those costly mistakes that you say 95% of Americans do who are on Medicare. So Part A is the hospital coverage, Part B is outpatient, also called supplemental, Part D is prescription drugs, and Part C is the private insurance plans. And the first part of this is, of course, we've got to enroll in Medicare, and that is a huge area of expense, unintended expense for many Americans.
We need to enroll in two parts to begin with: Medicare Part A, which is hospital, as you said, and Part B, which is outpatient. And now that people are working longer beyond 65, people have to determine, do I need to get Medicare at 65, or can I wait if myself or my spouse has employer coverage? So that's a decision point for people. And the other thing is, many people are delaying taking Social Security retirement. And that means they have to remember to apply themselves when they're 65 if they need to get that coverage. Because if you don't apply within what's called your initial enrollment period, which is the 3 months before and 3 months after you're 65, if you don't get in on time and don't have alternative insurance that Medicare accepts and says is okay, then down the road, you will face lifetime penalties for Medicare and some delays of getting parts A and B. So I always say, think about Medicare when you're 64. I call it reading the Medicare meter, and determine for yourself, do I need to get into Medicare parts A and B? And if I do, what's my timing? And if not, make sure that your coverage will allow you to have what's called a special enrollment period down the road, so you can get in at a time in the future when, for example, you do retire from that job and no longer have that employer coverage.
So how do you find that out?
There are two checkpoints. One is the employer coverage from a company with 20 or more employees? Because if it's a small company, Medicare will have to be primary. So even though you could stay with that plan and maybe it's Medicare certified, it's not going to be the best coverage. It'll only cover 20%. So if you're with a small business, be very careful about that. But if you're with a company 20 or more and you like your coverage, then you can usually stay with it, but verify that the coverage says it's Medicare creditable. That's a statement that they can provide routinely. Make sure that that statement is available, and most of them are anymore. And then you can get in down the road when you choose to.
But for the vast majority of us, we should plan to enroll in Medicare. And again, that Medicare meter starts ticking at 64. And what are the rules for the appropriate enrollment?
When you go to enroll in Medicare around your 65th birthday, you can enroll up to 3 months ahead of time. You can start the process. If you are already taking Social Security retirement, they will automatically enroll you in parts A and B. But many people are not. They're delaying that retirement benefit. So then you go, the easiest way to do it anymore is online. That was actually a big change during the COVID emergency, is that you could no longer even make appointments to go into the Social Security office. Now they are open, but they're really encouraging people to do it online, and it's really quite easy to do. Go online 3 months ahead of time, apply for parts A and B, and then once you get those two approved, you can look for what's going to be your prescription drug coverage and what's going to be your other supplemental type of coverage.
Are there any tricks to Part A and Part B to the hospital coverage and outpatient? Are there any things that we need to do in either one of those parts?
Medicare Parts A and B, the trick with them is they cover 80% of the cost of a service. And that's a general statement because it's really a complex fee schedule. So if you don't have a supplemental plan, you'll be sorry down the road if you have health problems, because there is no out-of-pocket cost limit in Medicare A and B. And let's say you have a $100,000 hospital bill, 20% is $20,000. You're best advised to have some type of a supplement that's going to cover most or all of that 20% that you have to pay. So that's your biggest pitfall. And some people don't bother to get a supplement. They think, oh, I don't need it. But once they become ill, it might not be the time for them to get that coverage. So think about it ahead of time and put it in place so it's there when you need it.
Right. So the supplemental comes under what?
That term supplemental is confusing because it's two main ways you could get supplemental. One is through a Medicare Part C plan, which they call it Part C, but it's really not a separate part of Medicare. It rolls together Part A, Part B, and usually a drug plan. And it works usually like an HMO that you may have had in your employer. So it puts the pieces together, and you purchase it through private insurance, and that does cover a lot of that 20% that you would be expected to pay. There still are co-payments in that type of coverage, so you can do it that way. Or you can get what's called a Medigap plan. A Medigap plan, there are 11 styles, so that's a whole nother layer of confusion. We do try and sort that out in our book. There are a couple levels of plans that I think are very comprehensive and are worth considering to purchase. And again, they will help pay for most or all of that 20% out of pocket for the hospital and outpatient services. But if you go that route with a Medigap plan, then you've got to pick up your own separate drug plan for yourself. Again, private insurance regulated by the government.
So no matter what, there's 20% of the coverage that you get from Medicare when you enroll that is not covered. So what are my choices in covering that 20% so I don't end up paying for it out of pocket?
Right. Your choices, you have one of two choices to make. And beyond that, there are multiple choices within the two main branches, you could call it, or roads to go down. One is to get a Medigap plan, which we mentioned, and that works kind of like major medical used to work. And it covers on a certain fee schedule things for Medicare that you'd have to pay out of pocket. Or you go for a Medicare Part C or Medicare Advantage plan. The difference between the two is that One will cost more in premium, Medigap will cost more in premium, but cover more sooner and limit your out-of-pocket costs sooner than Medicare Advantage often costs less per month. Some of the plans have no premium, which is great, and it works well for people if the doctors in your area are part of the network, and in some parts of the country it works well, and some other parts it doesn't work well. The other thing is, when people have a lot of healthcare costs, if you have a Medicare Advantage plan, the premium's low, but you still have a lot of co-payments, and you can spend up to $7,400 in a year out of pocket for those medical services. So it actually can wind up costing you more. So I know that's a confusing thing to think about. So I just say get out your paper and pencil and do some math. Look at the premium, the out-of-pocket maximum in a Medicare Advantage plan. Are my doctors in and are my medications in? Compare that, and that's what we do at Good Care. Compare it with what's a Medigap plan going to cost me plus a drug plan, and just do some simple math. It does take a little time, but you really can do it.
It sounds just off the top of my head, if $7,400 is the out-of-pocket costs kind of for everything, right? That's not covered by Medicare. That doesn't seem like a lot what your potential cost could be. Whereas the Medigap, you're also paying for prescription drug coverage plus the other benefits. So is there a rule of thumb for most people, or is there no such thing in senior health?
Well, first of all, let's clear up one thing that
Right.
I need to make clear is that $7,400 out-of-pocket limit is just for what your cost would be for hospital and outpatient. It does not have anything to do with drug costs. Drug costs and out-of-pocket costs will be similar whether you have drug plan within the Part C or separate. We do not yet have a prescription out-of-pocket cost limit. There is a new one legislated to go into effect in 2025. That'll be $2,000 a year, and that'd be additional. So if you have $7,400 beyond premium, and then it would be $2,000. But right now, there's no out-of-pocket cost limit in prescription drug coverage at all, whether you get it in an Advantage plan or you get it in a Medigap plan.
There's no out-of-pocket limit on either the Medicare Advantage or the Medigap plan right now
for prescription
drugs. Wow.
Yeah, wow is right. And that's how people can wind up spending tons of money. That's why we'll talk about how to shop up front to limit your excess cost, as much as possible.
Well, I know that's one of the questions that you get frequently from people. How can I avoid the kind of out-of-pocket costs that you're talking about with drug coverage?
When you have Medicare prescription drug coverage, whether it's in a Medicare Part C Advantage plan or it's what I call a standalone drug plan, it's really critical to do your homework. The best place to go for that is on medicare.gov, that website. It's free, you can use it, and put your medications in, because there are on average 25 plans that everybody could have in the United States for standalone drug plan, and 25 more prescription drug plans that are built into Medicare Advantage. That's about 50 plans. And the coverage will vary widely amongst the plans, even within the same company. So do your best to make sure your medications are covered, number one. And if they are covered, is it the best price? Because some plans will have it at a more expensive tier and some people will have it less costly. So you do that before you enter into a plan, and every year when new plans come out, which will be in the fall, coming up in October 15th through December 7th, you can do your shopping, and I recommend that people do that because most people don't. In over 3 years, say you picked a plan 3 years ago and it worked well for you, but your costs are going to go up, data shows, about 40%. And so it's really worth doing your homework when that opportunity presents itself.
And Medicare.gov, I mean, you said there are 50 some odd plans. Is it up to speed enough? Is it technologically advanced enough that it can actually find these things for you and it'll take you to the best plans?
It really works quite well, and a couple of different things. Medicare.gov, once you're already on Medicare, set up what's called your My Medicare, your own custom account. It will help auto-populate then your medications you're taking. You got to double check it. But once you are into a plan, it'll auto-populate that when you go to Medicare.gov, and make it a little bit easier. And I say Medicare.gov is the place to start. It's not the place to finish, because you're going to want to look at things, and usually it is pretty updated. But then you find a plan, go to that company's website or call the customer service and just verify to make sure you understand everything, and then go ahead and apply.
Aren't there various plans for various states as well?
Location is really critical in terms of particularly care providers, but let's just talk about prescription drugs. Many states also have additional resources to help people pay for all of these costs. And two different ones. Some are just for prescription drug coverage, and some other things are available through your state to help you pay for all of your Medicare premiums and costs.
One of the most costly mistakes that you write about in Making the Most of Medicare, your guide, is that if you use, out of the system providers, if you basically go to doctors or healthcare providers, healthcare services that are not covered by the plan. Mm-hmm. So tell me about that and what your best advice is, especially for those of us who really don't want to leave the doctors they had before they went on Medicare.
Well, it's true in any insurance, and particularly in Medicare. You're going to want to look up front, again, do your homework. Are my care providers in network? And if I get equipment, are they in network? In my hospital? And more, particularly the Medicare Advantage plans, are very network dependent. Some of those networks are what I'd call robust. You're talking to me from Rochester, New York, where the Medicare Advantage plans are very well accepted. That's not true all over the country. And another option might be to go to a Medigap plan, because there are no networks there. Any doctor, any care provider that accepts Medicare, you can apply your Medigap plan to. And so there depends on a person's lifestyle, what their health care is, and where they live. Also, people who are snowbirds or might be in a different part of the country on a regular basis. Some Medicare Advantage plans, again, would have a robust network, so it might work whether you're in the north in the summer and in the south in the winter. But if it doesn't work, look to a Medigap plan to provide more flexible coverage for you, because that's what it is. There are no networks involved in true Medigap plans. But I will tell you, I'm seeing more Medigap plans. They're advertised as Medigap, and they call them regional. Be very careful of that, because they really are not robust in terms of covering if you're going to be in the north in the summer and in the south in the winter.
Right.
I wouldn't go for a regional plan. I'd be very careful about that. And here's another thing. People will say, well, my doctor doesn't take Medicare. There are two different categories of that. Your doctor may not accept the Medicare rate, but does accept Medicare dollars. But they call it non-participating. And I always say my high school English teacher would say that's not a proper use of English language, because they do really participate. But that means that your coverage won't cover 100% of a visit. It might cover 90% of a visit. And that's a time when you want your Medigap, because it can pay additional. So if a provider has opted out, that is a legal process where they have to present you with a document. And you have to sign to say, I understand that my doctor has opted out of Medicare. That means I can't even apply for Medicare coverage for this visit. And they need to notify you up front. And there are only about 2% of physicians who have opted out. Most of them, when you hear they don't take Medicare, they don't participate in the Medicare fee schedule. So just clarify that with your care providers, because your coverage might buy you more than you think if they don't participate in the fee schedule but still take Medicare dollars.
Right. That's a really important distinction. Tell me a little bit more about Medigap. I'd like to know more about the Medigap plans and how to find a good one, because it sounds as if the Medigap plans offer you more than the Medicare Advantage.
Yes, Medigap can provide really comprehensive coverage for you for your out-of-pocket costs. I say can because there are 11 different styles, and some of them aren't worth buying, but a level G as in good plan, is available in most states. There are a few states like Massachusetts that have their own type of Medigap scheduling, and you want to look at that with your state health insurance department. In fact, we have a table about it in our book. But if you get a plan level G for good, almost everything is covered except for the Medicare Part B deductible. And after that, if Medicare covers a service, Medigap picks up the differential. And if you go to a provider that doesn't participate in the fee schedule, usually they'll pay anywhere from 5 to 15% more. So it can provide people much more flexible coverage. And again, no networks. You go to anyone that does take Medicare dollars, and your Medigap will follow with you.
And are there huge price differentials as well between the Medigap plans?
Oh yes, the
Yeah.
Medigap plans can be very costly, and they can be much more cost effective, and you really have to shop around. The industry knows that people don't shop particularly well, and people often go on a name recognition. And my advice is to pick the level plan, for example, a level G. There are a couple others that are worth considering. Pick the level plan, then look for a solid company. And they're the big name companies that you've used and worked with before. And then compare their prices, because they can be $100 difference per month. That can cost you over $1,000 more per year. So pick a solid company, pick a level G or something close to that, and then shop on price, because every company has to offer the same benefits. And so if one is $80 a month less, then I would go for that plan that's most cost effective from a solid company.
Are you hearing anything about trends or changes, major changes that might be occurring in the Medicare system in the near future?
I'm not hearing anything that's going to change in the near future in Medicare. There's a lot of fear about that. And when you look at the numbers, someday something's got to change somehow. Yes. But it's really unpopular to cut Medicare. But what I do see on a regular basis is that more things are pushed to co-payments to consumers. So rather than Medicare premiums going up drastically, the out-of-pocket cost for a prescription drug is going up. The out-of-pocket cost to see your healthcare providers. That's why we're talking today that people can position themselves best as possible. But there isn't a short-term change. The exception to that would be this new Medicare prescription drug cost limit that's going into effect in 2025. And that'll be interesting to see how that one works, because since there isn't a cost limit now, they're going to put the cost limit at $2,000. I am concerned that medications that are more costly are going to be more limited for people in terms of being eligible for those. So I think that's a subject that I would say stay tuned. We're going to see, we will be following that closely to see how that's going to impact consumers.
One of the questions that you frequently get asked by people is, how do I get coverage for a drug that I am denied coverage for? What is the process to do that?
There are several elements to the process to get a medication approved for yourself when you initially are told that you can't get it. First of all, they must approve it for 1 month for you while you are in you're going to look for something called a formulary exception. And work with your pharmacist and your healthcare provider. They're going to have to explain why it is that you need this particular medication. Then if it is denied again, there are 2 more levels of appeal where you can appeal that process. And in my experience, a lot of it's just language. Most of your healthcare providers will know the buzz terms they need to put in for you and your diagnosis in there, and that you can get those covered. Then, even if it's covered, certainly that next fall, do your homework, because just because it's covered for you on an exception basis, maybe that next year it's covered by another plan more cost effectively.
So that's why it pays annually to review what the drugs you're taking and which plans will cover them.
Yes.
Katie, one investment for a long-term diversified portfolio, what would it be to help us with Medicare?
The investment that I recommend for people to think about to help with healthcare costs is really related to long-term care costs, because Medicare does not cover long-term care. A lot of folks don't know that. And then long-term care costs come along and they can be quite steep. So what I recommend to consider is life insurance with a long-term care rider. That way, if you need long-term care, in addition to your Medicare, you'll have a pot of money available through that life insurance plan if it has a long-term care rider. So that's my recommendation.
I know they're becoming more popular, but are those becoming more available?
Those plans are more available, and they are more popular than the old school long-term care insurance. And the reason, I think, is because people feel like I'm going to get a benefit from it either way. And it makes it more feasible for them to think about how to invest their money as an investment into the life insurance that they could use long-term care or as life insurance.
Katie Vitava, thank you so much for joining us on Wealth Track once again. You always provide such invaluable information.
My pleasure.
At the close of every Wealth Track, we try to give you one suggestion to help you build and protect your wealth over the long term. This week's action point is read the latest edition of Katie Votava's book, Making the Most of Medicare, A Guide for Baby Boomers. Now in its 9th edition, it is the same concise, comprehensive, and easy-to-use guide to the very complex, multifaceted, and confusing benefit that Americans largely rely on to meet their health care needs in their senior years. As Votava explained, Medicare is not a one-size-fits-all system. It can be customized to meet individual circumstances and should be reviewed annually to make sure it is doing just that. Votava's book will help you maximize Medicare's benefits and avoid costly mistakes along the way. In this week's extra feature, Katie Votava discusses the important role artificial intelligence has played in her healthcare research. Next week, we'll have another in-depth interview to learn about strategies you need to build and protect your wealth over the long term. Please follow us on Facebook, Twitter, and our YouTube channel. Thank you for watching. Have a great weekend and make the week ahead a healthy, profitable, and productive one.